legislation was written in Rhode Island that would have allowed us to purchase insurance across state lines, and it hasn't gone anywhere. But it's there. The governors associations are working to push those initiatives through as well. Everybody understands there's 1,300 some odd insurance companies around the country. We can choose from just a few. So that is clearly also a cost savings measure. Thirdly, transparency. Do you know how much it costs to get your knee fixed, or to get a shot, or to get a pill? Transparency in pricing is critical. We do it with every other industry except for medical. And lastly, a form of health information exchange technology is necessary. Now, I'm more in the line of letting that be privatized. I'm not comfortable with the government having a database of health records. But the point being is that it could even be controlled on an individual basis. But so many duplicative services are done simply because of a lack of information. So that's a fourth step that I would put.
Yes, sir.
Yes, my name is Richard Kane from Portsmouth. I'm presently on Medicare, spending over $400 a month on my wife and I for the supplemental to get the coverage we need now. Much has come out of Washington. What is going to happen to Medicare to us people that are on Medicare? What's going to happen to our premiums, which are very expensive now and not any coverage at all? And it's so confusing now, you don't know what's really going on.
Joel, why don't you feel this?
I'm going to take a stab at it. One thing I want to remind everybody, and we've said it a few times, about 4 or 5 different bills, they all keep changing. So who knows for sure, but at this juncture, as I understand it, the design of Medicare will not change at all. But what will change is the reimbursement levels to the doctors and hospitals. Now, at first glance, we might say, well, that's good. They're going to cut the payments to the doctors and hospitals. But the problem might be that that's going to cause a lot of doctors and hospitals to either go bankrupt or refuse to take your Medicare, and that's going to reduce your care. So the concern there is it's easy to say, oh, good, we'll cut the cost of this, and that'd be a good thing. And the bad news would be then that less doctors and hospitals would be able to get more of the services they want. So there's nothing I know of in the design that they're saying, oh, seniors can't have their Medicare, or they're going to change it. But the doctors in hospitals may refuse it if they don't get paid enough to make a living.
If I could follow up just with some numbers, it's already so that the government is a very large buyer of health insurance. It deals, I don't know if harshly is the right word, but let's say that they deal very sternly with the hospitals, such that Medicare and Medicaid, they compensate at different levels. Medicare is anywhere from 20 to 30% below what your commercial carrier would be required to pay or is billed for a procedure. The hospital Medicaid is even lower. So there's a significant amount of cost shifting, much like the uncompensated care. There's already, this amounts to about 15% of your premiums, whether you pay them or your employer does. 15% of the premium that you pay is if payments were level, Medicare and Medicaid paid the same as commercial, and the hospitals were to come out again. The hospitals are, relative, almost controlled like utilities. They don't have a big margin. So if you assume the hospital needs approximately what it's bringing in the door, then and you level those payments, the cost of commercial insurance would go down. The Baucus bill has proposed partly to pay for, increasing, passing coverage so people don't have it by very stagnant Medicare reimbursement. So they're already reimbursing 20 to 30% below the commercial side. They basically have proposed to save $200 billion by not allowing those rates to increase at all. And so the phenomenon, whether there will be, or whether, the other possibility is that there'll be more cost shifting. This is not going to make the price of insurance for most people go down. So this Medicare effect is really a great deal of concern.
And then I think we have to be very, very careful with Medicare and what we do in terms of Medicare, because so many of our seniors depend upon that. We've already seen that there's going to be no cost of living adjustment for Social Security. That's going to put further pressure on income. And if it's private insurance that ends up making up the gap as Medicare reimbursements are cut down, that's going to put even greater pressure on folks that are already on fixed income.
You know, clearly when you look at the increase of costs, healthcare costs, different sectors, it makes Joel's point about the cost shifting. Medicare, Medicaid went up around 6%. Private care, myself, is around 9%, and then employment-based care is going up 12%. So clearly the cost shifting is already happening. But the big picture of Medicare, Medicaid, and Social Security, you know, you get these folders in the mail from Social Security telling you what you will receive for retirement. If you look at it, they don't even put it in the fine print. It's right there on the front page that the numbers that are inside that folder, you're only going to get 78% of that. It says it right on the front page. Unless something happens, you're only going to get 78% of that. So they already know that the funding for that program is down. 25% of long-term care is paid for out of private money. However, half of that is Social Security pass-through. So as we see the funding and the sustainability for Social Security dwindling, then clearly that will impact what long-term care providers have to pay. The price will be shifted somewhere else, because certainly the cost is not going to go down. Then there's Medicare. MedPAC, which is a lobbying firm, as it were, in Washington, that goes to Congress every year and says Medicare is too profitable for the service providers. You need to control these costs. And they get shut down by Congress every year. Well, the Obama administration is planning to make them a government entity now called IMAC. And that will change the rules a little bit, that they won't have to ask for permission. They will put forth proposals, and then Congress will need to act within 30 days so the proposals will move forward. This gives more control in the hands of government and will control those costs. So as we see Social Security dwindling, and we will see more constraints on Medicare, which is where the nursing homes get the larger share of the profit, clearly the pinch is going to go somewhere, which will leave us in only one solution. Medicaid population that will either be constrained by the services provided or the population offered. And that's my roundabout way getting back to the Medicaid issue we have in Rhode Island. Clearly, if we expand the population and we have a finite amount of money, the only way to make ends meet is to cut the services provided. And I don't think that's the way our culture wants to go. I think our culture is one more to say we want to provide the best care for those that cannot afford it themselves. But if you can't afford it, we expect as a culture to take care of yourself. So those are the choices that we're going to have to make.
Now, would you be more comfortable if I came around to the microphone rather than having to come up here in the center? We can do that, or would you like to come up? All right, come on up. I know it's sometimes a little intimidating because Johnny dancing for you here.
Hi, my name is Kat Christensen. I live on Buckway Street. I just had a question. Something I heard on television this morning, that 4 states were going to be exempt from helping to pay for health care. It was going to be Oregon, Nevada, Rhode Island, and Michigan. But there were 4 states, and does anybody, you haven't heard of this?
Every state. They don't want to pay the federal tax because they're 40%. And Harry Reid, Montana, and another one talked to the Senate Committee chairman and got a waiver so they don't have to pay the tax. They want all the other states to pay for the tax.
Right, but then Rhode Island is one of the states.
I didn't hear Rhode Island.
Well, I will certainly, I have not seen that. I can't comment on something I haven't seen, but I still will look into that. But keep in mind too that this is still in the proposal stage, and then when finally comes out of either the Senate side or the House side, has to go to conference committee to be reconciled. There's still a million changes yet to come. So stay tuned because the developments are going to be coming fast and furious. But I certainly will look into that.